How are molecular markers used to diagnose bladder conditions? Imagine a tiny fingerprint left behind by bladder cells that can tell us if something is wrong. That's what molecular markers do. They are biological molecules found in blood, urine, or tissue that reveal normal or abnormal processes, including bladder diseases like bladder cancer. These markers are becoming essential tools for doctors because they can help detect, monitor, and predict bladder conditions more accurately. One of the main ways molecular markers are used is for early detection of bladder cancer. They can find signs of cancer at a very early stage by identifying specific changes in DNA, proteins, or other molecules. For example, in bladder cancer, certain DNA methylation patterns, chemical modifications that turn genes on or off, are altered. Tests like Bladder EpiCheck analyze these methylation patterns across multiple genes in urine samples. They can detect cancer with moderate sensitivity, meaning they catch many true positives, and high specificity, meaning they rarely give false alarms. Markers such as TWIST, NID2, APC, and RAS1A are linked to both diagnosing bladder cancer and monitoring for recurrence. Because urine is in direct contact with the bladder, urine-based molecular tests are especially useful. They are non-invasive, meaning no need for uncomfortable procedures. These tests look for DNA mutations, like changes in the TERT promoter or FGFR3 gene, or for methylation changes and protein markers such as BLCA4 and hyaluronic acid. Tests like Uromonitor can detect mutations with high accuracy, helping doctors decide if a tumor has come back without needing to perform invasive cystoscopy every time. Molecular markers also help in understanding how aggressive the cancer might be and whether it's likely to come back or progress. For example, mutations in the FGFR3 gene are common in low-grade tumors and can indicate a higher chance of recurrence. Other markers can give clues about how the tumor might respond to treatment, allowing for more personalized care. After treatment, molecular markers in urine can serve as early warning signs of recurrence. They can detect residual disease or new tumors before symptoms appear or tumors are visible during cystoscopy. This early detection can lead to quicker intervention and may reduce the number of invasive procedures needed over time. These molecular markers are often used alongside traditional methods like urine cytology and cystoscopy. Sometimes they outperform cytology, especially for low-grade tumors that are harder to spot visually. When cystoscopy results are unclear, molecular markers can help clarify the diagnosis, guiding doctors toward the best treatment plan. Research is ongoing into new types of molecular markers, such as microRNAs, exosomes, and protein panels. These emerging tools could further improve diagnosis and monitoring in the future. However, many of these are still being studied and are not yet part of routine clinical practice. In summary, molecular markers are powerful tools that help detect bladder conditions earlier and more accurately. They work by identifying specific genetic, epigenetic, or protein changes in urine or tissue samples. While some tests are already approved and in use, ongoing research continues to refine their role in bladder health care. If you have concerns about bladder health, it's always best to consult with a healthcare professional who can recommend the most appropriate testing and follow-up based on your individual situation.